The Voice of Lupus Foundation president joins me now on the Zoom line. We say good morning, and as always, thank you for the time. It's REEANNA HARRILAL touching base with us this morning. REEANNA, great to see you.
Hi, good morning. It's World Lupus Day. Can't believe it's already here. It felt like yesterday I spoke with you.
That's right, and yet again, you know, that discussion regarding awareness, information that you're going to bring forward. We look forward to that. And today, at Library Corner in San Fernando, I think it's from 1 to 5 under the patronage of the mayor there.
Yes, it's actually a very special day, very historic,
right.
Actually. The Voice of Lupus Foundation, along with the mayor of San Fernando, His Worship Junior Regrello, we will be doing the official proclamation of World Lupus Day. And this is actually history in the making, because it has never been done in Trinidad and Tobago, and not even in the entire Caribbean region. Government leaders around the world are issuing proclamations today to declare May 10th as World Lupus Day, and calling for more research on lupus, greater awareness, public awareness, and of course for symptoms of lupus, and support services for those living with lupus in Trinidad and Tobago. So this is a huge accomplishment. It has been 13 years. The Voice of Lupus Foundation has been lobbying, has been championing the cause to give lupus a voice in Trinidad and Tobago. And today, I feel a sense of pride knowing that, the city of San Fernando, my hometown, my birthplace, is championing this for the organization. It's a big deal globally, according to the World Lupus Federation, whom we're members of for the past, it's been about 6 years. So I've been working very hard, and just it comes in timely with last year being awarded the Hummingbird Gold Medal for my work in advocating and providing support, over the years for those who suffer with lupus. And many of you may know my story. I'm also a lupus patient. So today we are going purple to make lupus visible. Jason, the symptoms of lupus, when you list the symptoms of lupus, they seem very common, like almost as if you're coming down with the common cold or the flu, even that of COVID-19 coming out of the pandemic. So the symptoms of lupus sometimes may not always be visible, but certainly those who are living and who suffer with lupus are not invisible. So today we are mounting this campaign, and we're transforming the city of San Fernando purple. And of course, we're partnering with the SWRHA to provide a multidisciplinary approach to treating lupus, to discussing lupus, because when you look at the disease itself, lupus is an autoimmune disease. It's a chronic autoimmune disease where the body's immune system, instead of protecting the body, it starts to wage war internally, attacking all the organs, tissues, and cells. There are 4 types of lupus. Many persons did not know this. There is a discoid lupus, which affects just the skin. There is systemic lupus. It's also the worst one because all the organs are involved, including the largest organ, which is the skin. And then we have neonatal lupus, which affects newborn babies and mothers who have lupus. And of course, something called drug-induced lupus. There are certain medications that are used to treat hypertension, cardiovascular diseases that can lead to lupus-like symptoms being developed, but that usually clears up once the medication is stopped. So today is all about awareness. We are encouraging Trinidad and Tobago. You have not left the house yet, grab something purple. Stand in solidarity with the organization. Go purple. Tell the story, tell the world, tell Trinidad and Tobago, tell your colleagues, listen, I wear in purple because of lupus awareness. We really need the awareness going, because lupus is one of those illnesses. You hear the name, but a lot of people still don't know.
And that's why this discussion is so important, because I'm trying to think here now in terms of, one, treatment for lupus. I want you to give us some details there. And 2, is it one that can pass down via the genetic line? Is it hereditary? What's the scenario where lupus will now present in someone? What's the origins really of the lupus?
Right. So according to research and scientists, there there isn't a known factor what may trigger lupus. However, there are factors that they have researched, and they've found that environmental triggers, there would be, of course, stress, then the genetic, the hereditary factor. There are a lot of lupus patients who, when they check their family tree, they would have had relatives with similar autoimmune diseases like rheumatoid arthritis, maybe a lot of persons, and we noticed this over the years, there have been persons who have been diagnosed with rheumatoid arthritis, and then eventually after the years, it turned out to be systemic lupus. And then there's something called mixed connective tissue disorder, where that's a borderline between lupus and rheumatoid arthritis. Now, there is that hereditary link. I mean, according to our patient registry, our own internal patient registry here at the Voice of Lupus Foundation, we have mothers and daughters living with lupus. We have, there's a whole family tree in Tobago where there's a mother with twin sister, her other sister, and then her daughter living with lupus on the sister Isle of Tobago, So yes, there is that hereditary link. And let me tell you something. Statistics show that 9 out of 10 persons who are diagnosed with lupus is a woman. So it's known as a woman's disease, but men also get lupus. And, Jason, there is that discrimination because a lot of people, because of lack of awareness, they associate lupus and HIV and AIDS. They think that it's linked, but it's not. A lot of people think that lupus is a type of blood cancer. It's a type of skin disease. It's not. I mean, yes, there are skin manifestations, but it's called an autoimmune disease. I remember doing a health fair recently, and a gentleman walked up and said, "Oh my God, this is the disease in the Bible called leprosy," and did not even want to step into the booth because of ignorance. No, there is no link with leprosy and lupus.
And that's why these discussions are, so important. I want you, to, again, just tell us in terms of treatment, and if you could tell us also the message, the message you will deliver later, the message you want to tell the nation on today's very important, I would say, commemoration, World Lupus Day.
Okay. So the treatment for lupus depends on the symptoms, because there is no cure for lupus, and there isn't a drug that's approved really specifically for lupus. So oftentimes in the health system, patients are treated based on their symptoms. And I mean, that's not good enough. I think that, and I would say this, and I really would not apologize, I think the lupus community here in Trinidad and Tobago, we are medical orphans. Since the pandemic, we are medical orphans. And I say that because we get lost in clinics. We are bounced around different places, and there isn't a structured multidisciplinary approach. We do not even have a proper lupus center. And this is what the Voice of Lupus Foundation has been working towards, setting up the Lupus Learning Resource Center. It is going to be a hub where we are able to treat and take care of our patients, because a lot of lupus patients are constantly living in fear. They're living frustrated. They're dealing with mental illness because of the anxiety and depression that comes with living with lupus because of the health system. The health system has been failing a lot of us. I mean, during the pandemic, when you look at the symptoms, of course, we're going to have fever. Many patients, they're flaring, they go to the hospital, and they're thrown into the COVID tent, and then further risk, and they contract COVID, and we need to be more sensitive. And I think my message is around raising the awareness this morning about the symptoms of lupus. Again, I keep saying the symptoms of lupus are very, invisible, but lupus patients are not, and we need to be heard. And I think it is a really sad thing where it's unacceptable, even now that telemedicine served its purpose during the COVID pandemic, but it is not an excuse for patients waiting 9 and 10 months to see a doctor when all you're doing is getting a phone call and then come collect your prescription, but there's no follow-up. Yes, you can do blood work, but we know how the public health system goes. These patients, many of them on harsh immune suppressive drugs, depending on the symptoms of lupus. Many patients go on immune suppressive drugs. You suppress the immune system.
Well, REEANNA,
drugs, yeah.
I'll tell you this. As we look to wrap things up this morning, I'm looking on, I'm listening. I know the nation is also listening. You know, they can feel the passion. The conversation will obviously continue today and beyond. You're free to come on at any point in time to give us updates, and I want to wish you the best today. I know that from 1 to 5 and even beyond, Library Corner San Fernando, you'll be very visible, and this message will rebound and resonate, and let's put the energy out immediately for improvements and for awareness and for a greater health, I would say, system to treat with this. I want to thank you as always for coming on, and we'll touch base soon.
Thank you for having me. Appreciate you, Jason. Thank you so much.
That's right. The president there of the Voice of Lupus Foundation, REEANNA HARRILAL, touching base with us yet again for World Lupus Day, which is today. And today they celebrate in San Fernando. Up next, that's right, the information there for all to see. And kudos there to the mayor for making this possible. Up next, we get some details from Albert Marshall, project manager for the secondary schools anti-bullying conference that takes place today. Details up next.